Oops. Hello, everyone. So I hope you had a very nice lunch. We're going to start with the next session. It's going to be facilitated by Susan Ellis and Brian Otieno. And we have a very special guest. So I leave now the floor to Susan for the facilitation.
Hello, everyone, and welcome back from that delicious lunch. We're so glad to have you, and we're really looking forward to our afternoon session on FBO interventions that advance HIV epidemic control by addressing stigma and discrimination, which I know we've really enjoyed conversations about that this morning. So we're in for a great treat this afternoon because we have three speakers, including our ambassador at large, Dr. Nkengasong, who will be opening us up, followed by Monsignor Robert Vitillo from the Vatican, and finally we'll hear from Matt Kavanaugh from UNAIDS. So without further delay, Ambassador Nkengasong, please come to the front. Is there a mic up there that's...
Thank you so much, Susan, for the introduction. And Sandy, UNAIDS family, for inviting me to be part of this conversation. I must say that I'm truly honored to have been invited to participate at this important session. And if you don't mind, Sandy, I know you put up those slides. I will speak without slides. Two things before I go into the core of the discussion. First is that I arrived at 11 o'clock in Montreal, and this is my first outing at the AIDS conference. So, second is that this is about my 6 or 7 week at PEPFAR coordinator. So I'm still at that window period where I can make mistakes. And you all will say, you're still learning. So I think down the road, it will be difficult to make mistakes because you expect me to know everything as the coordinator. So let me start with that perspective. As we gather here today and this week, you'll be hearing, all of us will be hearing from UNAIDS that has actually rang an alarming bell to all of us. That we've made remarkable progress over the last 40 years in the fight against this pandemic, and I use the word pandemic very deliberately. But there's also remarkable challenges that lie ahead of us. And for several reasons, we know that in public health, as we fight an enemy as challenging as HIV, or any disease for that matter, towards that tail end of it, it becomes even harder and more complicated. We saw that with polio, and we've seen that with many other diseases. But I would argue that people who believe in those who eradicated smallpox will tell you that in the whole exercise of disease eradication, addressing issues of discrimination, rights, inequality, at times is seen as a burden. But you cannot eliminate any disease without addressing issues of rights, inequality, and access, especially stigmatization and discrimination. So we find ourselves at a place where we project to 2030 and we say, it looks like we can win the war against HIV/AIDS. It looks like we can win the war against it. But the reality on the ground we're seeing today from UNAIDS, whom we rely on every day to provide us a compass of where this struggle is going, is saying, look, we are bending the curve, but we are not bending it enough. The HIV/AIDS pandemic is in the community. And without community leadership, and this is the first time I'm using the word during this AIDS conference, not community engagement, but community leadership is going to be critical. And who is the community? Who is the community? It's all of us. It's you. It's faith-based organizations. Let me astray from HIV for 1 second. I'll come back to it. I just finished a rotation in Africa as the pioneer director of the Africa Centers for Disease Control and Prevention, which is a specialized agency of the African Union. And COVID hit about 2.5 years ago. And our greatest cry was to have access to vaccines, COVID vaccines. Just let's share HIV for 1 second. I'll come back to that. And when vaccines were available, we saw what I call the peaks and the trough in uptake of vaccines. Some settings, some troughs or peaks, I beg your pardon, occur when people saw people dying of COVID. So you rush to go get a vaccine. And when the infections, as they call them, waves were decreasing, nobody wanted vaccines. But central to that was the trust capital. The trust capital, where we sat back and in the pilot countries that we wanted to roll out COVID vaccination, we said, let's go to the faith-based organizations and engage with them very openly, have a discussion first of all, and let them lead the exercise. And I remember personally in Cameroon, where we started one of our first vaccinations exercise for COVID. We went to the mosque and had a conversation before with the imam. And after that, after the prayers, on Friday prayers, all he did was to make mention that and express confidence and trust in vaccines, COVID vaccines. And we saw after that a long line, meandering line outside, people wanting vaccines with their arms out short there. We thought that was probably an aberrant occurrence. So we went to another town in Cameroon called Bamenda and met with the bishop, Catholic Church bishop, and we did the same thing. This was on a Sunday, and I have pictures to show. I can send it to you. All that the bishop or the priest, I can't remember if it was the bishop or the priest, did was to, at the end of the church service or mass, he said, there's a caravan out there with COVID vaccines. Go out, get your vaccines. They are safe. They protect you and protect your family and protect the country. I have pictures that you see long lines of people, worshippers, standing out there and worshiping. So let me come back to HIV. HIV is an old pandemic. We've learned lessons from HIV to fight COVID. And we are now learning lessons from COVID to fight HIV, even though it's a new pandemic. But the centrality of whether you're dealing with an HIV pandemic or a COVID pandemic is the community and the trust on who is leading that effort, not engaging that effort. So going forward with PEPFAR, as I will be disclosing tomorrow, our strategy going forward is rather community leadership. I want you all to be leaders in the fight against the last mile as we struggle with this pandemic. We have to bring it in the community. As we always said, it starts in the community and ends in the community. And that trust capital is what we have to rely on. To address issues of discrimination, stigmatization, which only help to drive the disease underground. We know this. I've been in HIV since 1988. I've moved from a basic bench researcher as a virologist to a policymaker. and exited HIV. I thought by the time I come back, people like Matt and Sandy would have solved the problem. I thought it was challenging for them. I came back and so to help support that. So let me just, as I conclude, say that you can count on PEPFAR to continue the journey in the fight for rights, discrimination, stigmatization, because I think those are the structural barriers that will make the journey towards the last mile extremely difficult. We have to collectively hold hands and say that the enemy is the virus, not people. The enemy is the virus, not people. And let's focus our conversation where the true problem is. The problem is the virus, not people. So I thank you all, and I look forward to working with you going forward.
Good afternoon, and I think I'll follow the example of the ambassador, so you could leave my slides out, and I'll just try to share some thoughts with you. First of all, it's a real great joy to be together with so many of you that I've known over the years. And when Sandy and Francesca were giving me strong words of encouragement about coming, I told them they didn't need a dinosaur once again, you know. And yet then I also knew very well that these are two formidable women whom you don't refuse. So I'm here, and I'm glad to be here. And it's been really just a wonderful morning, and certainly to meet the ambassador is a great honor as well. I don't feel very worthy to follow you on the podium, so I'm sorry for the little bit that I can offer. But I think my small contribution is to try to reaffirm that religious leaders, faith-based organizations, and people of faith address stigma and discrimination not only because of some special techniques that they have, although they do have those as well, but simply being what and who they are, filled with faith, determined to do good and untiring in their advocacy for and with people struggling with inequalities, prejudice, and many of the isms that are all too prevalent in this sin-filled world and among us sin-filled people. In the Catholic Church, we believe that the Church has a threefold mission: to teach, to serve, and to worship God. And we fulfill that mission in our walking with people living with and affected by HIV, not because they are in some special category, but because we teach and firmly believe that they share our very identity. We are one with them, women and men, girls and boys, with whom we share the gift of being created in God's very image, gifted with a unique identity that must be respected and held sacred from the very moment of our conception to our natural death, deserving of our service because of what Jesus mandated us to do in his gospel and through his own example, and that is to love our neighbors as ourselves, and everyone is our neighbor, not just certain people that we like or not like, as Canon Gideon said this morning as well. Finally, we believe that our worship of God extends far beyond the formal prayers that we say in church or even in the quiet of our hearts. Our worship should and is translated into the service that we offer to our neighbors. And in fact, in the Catholic Church, we consider that among the most sacred words of worship are those that are pronounced at the end of our service. Go and announce the gospel of the Lord. And we announce that gospel by serving others through our works of charity and justice. So I think sometimes we look for big strategic plans for ending stigma and discrimination. Those are necessary as well, but they're also part of us as people of faith, and we just need to act on what we believe in doing good for all people that we meet. I think it's also very, very important that we make sure that we tell people about what we do. And I have to say, this is something that I feel that PEPFAR has done very well with faith-based organizations in terms of really assisting us to analyze the good that we do and to report on it. And I don't think it's only by numbers. I think we also have to talk about the people that we've helped and make sure that people stay at the center of all of those numbers. But I know when I got started in the work on global HIV work, many times, I'm from the days of when we used to have to go to the Global Program on AIDS at WHO to find out what was happening with the epidemic, because we didn't have the internet even yet. And so, and many people in governmental organizations as well as intergovernmental organizations would look at me with the Roman collar and say, well, you know, I guess you people do good, but we have no idea what you do. And yet it was with PEPFAR's insistence that we start looking at the numbers and showing the outcomes that we've been able to do that. And I myself published 2 books on the Catholic Church's work on HIV, and a lot of it was based on the statistics that PEPFAR forced us to put together. And yet also, we always made sure we had the people and the people who lives with the virus, as well as those directly affected, giving their testimonies in those books. So we focused on people, but we had numbers for those who maybe couldn't believe that we really did good. And I think we have to continue to do that. And I really have to say that came to my mind as I was preparing my thoughts today, because I just returned, my present work is serving as a Secretary General for the International Catholic Migration Commission, so global programs on working with refugees and migrants all over the world. But I haven't given up my work on health either. But I just returned from Ukraine. And I saw, you know, the many people who are now displaced in Ukraine. I also visited first in Poland, since you can't fly into Ukraine. I'm sure that that you had the same situation as you were leaving Ukraine. So, you know, and I saw the great work that churches were doing there, churches and others of faith, but I also saw that there was such a lack of medication, even basic medications, and visited many of the church centers where they were sorting through medications that had been donated so that they could share them with the displaced people, or in the case of the Poland side, the refugees. And, you know, certainly I had calls during these last few months about people who were refugees living with HIV and yet couldn't get connected in the country where they were, even though that country had said any Ukrainians who have sought refuge in this country will have access to health care, but they couldn't get connected. And so I think those are the kinds of things that we do as church. Yeah, I went from there. I was invited immediately as I left Ukraine to go to a special session of the European Parliament on the religious response to Ukraine, and shared what I had seen about how the religious groups were responding. And also, I was accompanied in that session by the chief rabbi in Poland, and also by an imam. All 3 had been in Ukraine, and so they brought the same kind of messages, both about what's happening in the countries of refuge, of asylum, and also in Ukraine. And yet, at that meeting, there were some people claiming to represent the secular world who told the governments and the European Parliament that they shouldn't have been working with religious organizations, because religious organizations forced conversions and simply condemned people. And there was a strong reaction from my Jewish and my Muslim colleague on the panel to say, this is not true, and you're speaking from an ideology. You haven't even been there to see what's happening, and yet you're condemning. So I think we have to make sure we don't keep our lights under the bushel basket. Jesus told us we should let our light shine all the time, and we need to do that in this case too. And not simply develop a complex around stigma and discrimination, because some religious leaders have abused that and have spread stigma and discrimination and disinformation. But let's remember that probably the much larger group of religious leaders and organizations are giving correct information and are reaching out to all people who are in need. And we need to tell that story and tell it loudly. And I hope we can continue to do so through this. But as one of our colleagues said this morning, let's go home and tell the story too. And let's do the things that we say we're going to do. I think also I wanted to focus a bit on a community that doesn't get mentioned very much. It was mentioned briefly by Matt this morning, and that's children. You know, they're a community, and they're a community that is discriminated against in the AIDS response. Because we saw for many years now, we've known that, you know, children didn't have the same access to treatment and early diagnosis. Some of that was because we didn't have the right technology in place at that point in time. We didn't have the right kind of testing instruments to test children. And also, we didn't have the kinds of formulations and the dosages that are appropriate to children. And to have a mother, an HIV-positive mother whose child was now positive, be told, go home and cut up this pill. I don't know if any of you cut up pills, but I've tried to do it. And it sprays all over the place. And I had a pretty sharp knife when I did that. And yet, many of the women in the villages don't have that. And so, the Catholic Church was very aware of this, and many of the other faith-based organizations were aware of this. And in 2016, we gathered a group of people from different faith communities that were working with children and watching those children continue to die when many adults were on treatment and were doing so much better. And we gathered them in Rome and tried to share our information and also our concerns about this, and tried to think of how do we overcome these obstacles. And we developed a plan for trying to focus more on children and to put more pressure on the pharmaceutical manufacturers and then later the diagnostics manufacturers to do more R&D, research and development. And yet, when we gathered them, we then went the next step, and Cardinal Peter Turkson, who was then the president of the Pontifical Council for Justice and Peace, a Ghanaian, decided that with us, he would call together the heads of the pharmaceutical companies in Rome at the Vatican's Academy of Sciences. And this was in 2016. We had 2 meetings with them that year alone. And as we gathered, first of all, it was the first time the generic manufacturers and the R&D manufacturers ever sat in the same room and talked with each other. And lo and behold, they found that some of their challenges were similar, especially some of the regulatory mechanisms that were put into place to try to protect children, and yet, you know, were hurting the children. Because it took so slow, such a slow process. And, you know, the manufacturers said, yes, we could do more, but it's still going to be 7 or 10 years before we could produce any new formulation or any new dosage for you, because these are the regulatory situations. And so once again, then, we continued to convene these groups of people, but we invited the regulatory agencies as well. And I remember at the 3rd meeting that we gathered in Rome, there was a representative of the U.S. Food and Drug Administration, and this issue on the regulations came out. And because there was a regulation that you couldn't start the research on child formulations until you had finished the research and got approval for the adult formulations. And the representative of the Food and Drug Administration said, I could change that. And I was chairing the session, and I said, you really could change this? I mean, you're willing to do this? And yes, I can do it. And you'll put this in writing? Yes, I will put it in writing. And they did change the regulation. And then we also worked with many other regulatory authorities throughout the world. And we were very, very pleased, Ambassador, when the Africa CDC was started too, because we knew how much need there was for this in Africa as well. And we've made great progress. So far, we've had 5 of these meetings, 4 of them in Rome. The last one in the end of 2020 was virtual, but we had more than 150 people on that call throughout the time. And I think the important thing is that, sometimes we're willing to put the blame on others and say that they're discriminating against, but we're not always ready to really analyze what that issue is and try to find common solutions. And I believe that because of the leadership of the Catholic Church, inviting other faith-based organizations and the business world, the private sector, as well as the regulatory authorities and the ministers of health, especially from the countries at the highest rate of infection among children, that's helped us. And now we've made tremendous progress in getting new formulations and also appropriate dosages for the children. But we still have a long way to go because we still see the statistics that Matt shared with us this morning, that there are still higher rates of children being infected and also higher rates of HIV-related deaths among children than there are among adults. And that's a discriminated group then. And we need to pay attention to that, as well as to all of the other kind of social and other kinds of discrimination that goes on. So I wanted to take the opportunity to focus on that group of children and to say that I personally continue this commitment, and we really have had wonderful support from PEPFAR and also great leadership from Francesca in helping us on this. And we're hoping now I wanted to also share with you a message that the Pope Francis, sent to us when we've gathered that first group of pharmaceutical manufacturers. He said, "Let the dialogue continue until we find the will, the technical expertise, the measures, and the methods that provide access to diagnosis and treatment available to all, and not simply to a privileged few. There is no human life that is qualitatively more significant than another." And I think that kind of guideline and that kind of appeal from Pope Francis really has underpinned all of the work that we've done for the past 5 meetings. And now we're hoping to convene a 6th meeting in Rome, since I hope that travel restrictions will allow us to gather there, maybe by the end of this year, hopefully by the end of this year. And at that time, we've really made a lot of progress, but there's still more to be done. And some of it is related to the finding now. We've kind of found many children and had early diagnosis and testing through the traditional health sector, but there are many children who don't get to that traditional health sector, or whose mothers take the antiretroviral treatment during pregnancy, but then stop it. And they're able to transmit then during breastfeeding. So there's a lot more case finding we need to do, and I'm sure that the faith-based organizations are the ones to do that case finding and to then go the next step for the testing and for arranging and following the access to treatment for these children. Too many lives are being ended too early, and we need to make sure that we could stop that situation. I'm getting the sign from Francesca, and I always obey Francesca. So I want to thank you for having me be here, and please remember the children.
Thank you all, and it's such a pleasure to follow these 2 giants on this stage. Unfortunately, sorry, Ambassador, that we did not end AIDS while you were gone. Well, we tried while you were gone to end it, but you've had to come back so that we can have you with us again so that we can now end AIDS. Let me be very brief, only because with apologies, I'm going to run to the next piece, which is that we're launching our report briefly, and so that's going to happen shortly. I want to say a couple of things just about stigma and discrimination. So just as we think about these pieces, for us at UNAIDS, one of the core questions here is, what is stigma and discrimination? How do we stop it? How do we shift it? And that's where this room has such an incredibly powerful role, right? We often think about stigma and discrimination as something that's kind of vague, out there in the world, hard to kind of understand. But as you heard from previous speakers and as you all have been dealing with here in this room, we can measure it, right? With the Stigma Index and with GNP Plus's leadership in UNAIDS, we can actually measure how much stigma is there. And that means we can also intervene in it, right? We can take it seriously, not as something that would be nice to solve at some point. If ever we can get to the world of social justice, then we can end AIDS. That's not what this room is about. That's not what we're about within AIDS. We are saying that we can, within contexts of deep inequality, we can still end stigma if we're smart about it and if we're strategic about it. So on that front, let me just say a couple of very brief things. One, we have evidence that this has happened. So we can look, for example, to Ukraine. Father Bob was mentioning Ukraine, and this is an incredible example where reductions in stigma have been really massive. Why? Because they've had programming to fight stigma, they have brought faith leaders together, they've changed laws, and they've trained healthcare workers, and they've done the same for police. Similar things are happening in Nigeria, in Kenya, in Cote d'Ivoire. These are the places where we see significant declines in stigma. And also, surprisingly enough, these are the countries that have done by far the best in stopping new transmissions of HIV. So these two things can't be separated out from each other. We can't say, we'll do biomedical interventions over here and hope that they will overcome stigma. But also we have documented clarity that if we don't give people access to treatment, if we don't give them easy testing, then that's actually what builds stigma. That when the biomedical interventions, when treatment didn't exist, that's what drove stigma the most in the world. And now we're seeing it new with PrEP, with other biomedical interventions. So we've got to bring these two things together and say we've got one fight here, but we've got to bring them together and do them together. And that is why, let me just say some thank yous, which is thank you to the leaders who have been putting together this partnership with PEPFAR and UNAIDS and all of the faith-based organizations. Thank you to the colleagues in Nigeria who brought together Muslim leaders to address the reality of HIV testing in marriage, which was saying that there was testing and one person was becoming a positive and that ended the marriage. Look at the way in which Muslim leaders have come together to say no. When somebody is positive, that's a moment for learning, that's a moment for evidence, it's not a moment for stigma. Thank you to the colleagues in Uganda who have been building the faith-based action plan that was just launched by the minister, by the Prime Minister, right? Where the main contention is around stigma and discrimination. As Ken Gideon was telling us before, he himself had a key role in actually getting this together so that now we're moving teenage pregnancy from a question of sin to a question of how do we hold people up and give them support, and how do we ensure that that is integrated with HIV prevention technologies. And thank you to the Interfaith platform. I'm told, and I did not know this before today, but I'm told that there are 2,000 faith leaders who have signed up through the Interfaith platform to be able to do not just the day-to-day in their communities, but to be global leaders in actually doing that. Because nobody in the world knows better, I think, than faith leaders. How do you change norms? So from here, as Ambassador Nkengasong was saying, we have to change policies, we have to change laws, and we have to change norms. And we only get there if we actually have the leadership of faith folks in this community. But to be clear, the fight ahead is bigger than the fight behind us. Because as John was saying, we're nearing this space where we can no longer do the easy work. And so we really thank you for being here. But we also have this call to action, is that what we need from you in the next 2 years is actually more focus on the hardest issues, more focus on the most contentious issues, and more focus on the things that we'd rather not talk about. The stigma, the discrimination, the reality of the lived experience of key populations, and we need you to be helping us move those things. Because if not, we won't end AIDS. But if we do that, we know we can. So thank you all.
So thank you everyone, and thank you to our ambassador, and to our bishop and Matt once again. Thank you. So I'm going to open this session to questions. We're going to take a few questions before our ambassador leave and Matt. I see he's already carried his bag. Matt, you can just place your bag down. Yeah, 5 minutes. So we're going to take very few questions. As you can see, Matt is in a hurry. So we're going to have online questions. People who are joining us virtually, and the team here. So going once, that's one. Going twice, and Katha. Okay.
Thank you. So thank you for your all three of your talks. They were interesting. My question is for Monsieur Vitillo. So at this conference, right now we're talking about stigma, and this morning Reverend Bayamugisha discussed misaction. And so when we talk about comprehensive care without education and provision of condoms, which I know in a lot of Catholic spaces are not as common, how can we be sure we're not adding to stigma on the use of condoms and engaging in misaction when some communities can get education and provision to condoms, which is a safe and effective tool at preventing HIV?
Okay, Nkatha.
My name is Nkatha Njero from the Africa Christian Health Association's platform. My question goes to the PEPFAR ambassador. We as faith organizations have been very grateful to the work that we have been able to do through the Faith Initiative and the FCI. However, this is not continuing with the current COP. And whereas we acknowledge the priorities of PEPFAR, there have been a lot of gains in the last few years, especially through FCI. And one of the advantages of the faith groups that we all agree on is that faith communities are there to stay, unlike projects that come and go. But Canon Gideon and other faith leaders that are in this congregation will continue to be in their congregations. And whereas a lot of the work that is done through grants that are with large organizations with a lot of capacity, being able to appreciate the work that is done through faith communities and finding a way of entrenching such work through PEPFAR has evidently been given us very good results. How can PEPFAR ensure that this work goes on by finding a place for such initiatives as FCI? Thank you.
Yeah, thanks, colleagues. This is mainly for Father Bob, but it sort of goes into Ambassador Nkengusong's point too. You spoke a lot around children, and in fact, in a lot of human rights mechanisms, Convention on the Rights of the Child, lots of Human Rights Council outcomes, the engagement and meaningful engagement of children in processes that affect their lives is guaranteed. It's a right for them. So I was wondering, from your experience, how much child engagement has happened in that work? What lessons can we learn? And if not, how can we improve on child engagement in the work that you're doing on treatment, access, etc.?
Okay, so I'm being told there are no questions online. There is one. Okay. So as we wait for the online question, on behalf of young people, mine would be, how does integration of services, especially among young people program, look like? What's the future of young people integration services living the HIV and faith communities look like for us in the future as you take up this role? And congratulations for the new role that you're taking up. Yes. So I think we'll just take that and the one question. So we have a question from Stuart. So Stuart has a question for Dr. John. Will PEPFAR continue to prioritize funding for children and adolescents living in the HIV and for achieving the 2025 global targets for these vulnerable young people and build on the great work done in the past? So I think that just builds up to what I've asked. Yes.
That our guests have to leave because there is going to be the launch of the new report now. So we thank them, and we are going to continue the conversation with the people present here. So we understand we have to run to another meeting, but maybe the ambassador wants to take the floor before we close this. Thank you.
Yeah, thank you. Very important questions, and I really wish we could stay a little bit longer. And you all know the dynamics around the big meetings where we've not seen each other for face-to-face for a couple of years, and now we're coming together to address these issues. I think about funding for faith-based organizations, as I said earlier, this is my 6th or 7th week in this space, and as I learn more, and as we chart our priorities going forward for PEPFAR, I think it will become obvious where we allocate resources to address the problems. We have to address this by data. Where is the virus? So that we can know exactly what structural issues need to be addressed around the community that will be required in doing that. But for one thing, I'm sure, and this brings me to the second question about the young people. I like that signage down there, says, sign the campaign. What I will certainly do as PEPFAR coordinator and begin to release some of my own priority areas here is to really hope that we can create a movement of the young people, that they can become champions and leaders in a campaign that I hope to launch called Young People Against HIV/AIDS. And that would not include Young People Against HIV, where we all say that we would, as young people, be champions of the issues that we are discussing here, stigmatization, discrimination, and just HIV, especially in the young people there. So stay tuned, watch out in that space there.
So thank you so much. We're going to continue this discussion as they leave, but we're still taking up questions. So in case of any questions, kindly let's continue the conversation in here. So any questions? Yeah. So, okay, sorry.
Well, thank you for the two questions that I heard. One is in terms of education. First of all, I've written several books on education on HIV and AIDS, and used them for training of religious leaders and people of faith in different parts of the world. At least in what I've written, we talk about different ways to prevent the spread of HIV, and especially through sexual means. We do talk about the use of condoms for those who are going to be at risk or putting other people at risk. We also talk about faithfulness in marriage, and we talk about abstinence. And those are three ways to do it. And in a way, when people only bring up the use of the condom, they're discriminated against other two ways. And so I think it's important to take a holistic approach and then have people make the decisions, not others who decide for the people or tell them they have to use condoms. Or I've had many people say to me, abstinence is only for crazy people. Well, I'm sworn to abstinence, and I hope I'm not too crazy. I think we have to see things in a holistic way, and then also help the people make a decision. I'm trained as a professional social worker, and a lot of times, even when I first started training doctors and nurses on HIV, they'd say, tell me what I have to tell the people. Well, no, we're not prescribing here. You prescribe the medicines, but we have to help them empower themselves to make the decisions on their sexual life and on many other aspects of their life. So I think that's important, especially when people refer to comprehensive sexual education, but they don't mention the other ways to avoid the sexual spread of HIV. I think we have to be complete in what our information is, but not decide for others how they should behave. In terms of the question about young people, certainly the Catholic Church and many other faith-based organizations are involved in education of children and young people. And they talk with the children and the young people about these things. And they hear back from them. I personally have accompanied a number of programs in Asia on working with children who are living with HIV. And many of these children had been abandoned by their families, and so they're living in a group living situation, but the people who have run those facilities, first of all, have made sure that those children have access to education, and even have had to negotiate with some of the Catholic schools to help them understand just what Jeannie shared with us today. But they did that, and then they made sure the children could be honest and yet still be protected as they went to school. And now when I first went to this one facility in Vietnam, I saw all of the urns of the ashes of the children who had died already. And now it's wonderful when I go there and I could see the little kids with their backpacks on, their backs going to school. But also those children are now being taught as they grow up to go into independent living, and there's a transition for them. And again, they're taught that they don't have anything that they have to be shameful about their situation, but they also have responsibilities in terms of, how to interact and to, especially when they're ready for a sexual life, how to have a sexual life. So there is a lot of listening that goes on, and certainly I personally have tried to do a lot of training of religious leaders in my own church to get the facts and information, and then to spread that information correctly, but not to abandon the values that we have and that we believe we receive from Jesus himself.
I see there's a question from Jen.
Thank you. My name is Jane Nganga. I work for Inerena. I've been struggling with the concept of meaningful engagement of religious leaders. And I think this is something we need to unpack so that from UNAIDS perspective, what does it mean to meaningfully engage faith leaders? From PEPFAR perspective, how does it look like? And I think maybe one of the actions out of this meeting, we may need to think about guidelines around meaningful engagement of faith leaders, which is not based on programs, which is not based on issues as they come and go, but how can we meaningfully engage faith leaders? And knowing we have all said the influence, we've talked about the reach, we've talked about the sustainability that faith leaders, faith communities bring on the table. We need to unpack and define it so that we have common understanding going forward. Thank you.
Thank you, Jen. So I see it's clear. Any other question? Yes, Yasik.
Thank you. So just the reflection on what Reverend Jane is saying to us. Some of you who were with us 2 years ago during the previous pre-conference, the one that was virtual, you definitely remember that at that time we were also thinking about, of course, like Reverend Jane is too young to remember that 13, 14 years ago already we had this global meeting of different religious leaders on the on how they, based on the existing evidence, should address HIV response. And 2 years ago, the issue returned because the outcome document of that meeting that happened actually 14 years ago was the engagement, strategic engagement framework with religious leaders that was established by us together. Yes, that we had that good discussion, how, with what specificities, with division on which issues for which religion, church, faith group is important, is prioritized, etc., etc. So to make this introduction shorter, I think that we as UNAIDS, and I'm pretty sure it is the same with the PEPFAR colleagues, we do realize the need for such a deepen dialogue, and our conferences like this one, which are happening only once in 2 years and are disturbed by so many other important events happening around our pre-conference, yes? This is not sufficient, and this is definitely not enough for making this kind of refreshing step. And I am saying this with one particular issue in mind. I am like really delighted, this is a honey on my heart, seeing so many young people here today, having more than 120 young people signed as young people online listening to us right now, this very moment. This is for me like a very significant moment that maybe the time for this refreshment is right now, and we are approaching this momentum to give it to the next generation to do it better than, okay, to continue. And let's have it in mind when we will be discussing tomorrow, like the next steps, what is after, because who knows, maybe next year, maybe in 2 years, instead of having pre-conference, we will have a global meeting of religious partners, religious leaders, faith communities, and faith-based organizations on renewal of the existing, outdated maybe in some parts, global guidance on working on HIV among our institutions, organizations, and activists. Thank you.
Thank you so much. So with that, I'd like to hand it over to Susan, and let's tell our story. Let's keep the conversation going. Thank you so much. Over to you, Susan.
Thank you. Brian, can you just put your finger up when it's been 5 minutes? I'm going to do a 5-minute summary. So I want to do a summary and also answer some of the questions that I think our friend from HAP had asked of the ambassador that I have some information on and can share the answers to. But I'm going to summarize. It was so delightful to have Ambassador Nkengasong here with us. And couldn't you all feel his engagement and enthusiasm with recognizing the faith leadership and its value? And so I think that certainly warmed my heart, and hopefully it meant a lot to all of you as well. He was reminding us that we've made a lot of challenges, but we have made a lot of progress. There's challenges ahead, and the end is always hardest, which means we need your leadership and all of our leadership even more. He also helped us focus on the fact that the enemy is the virus, not the people, and we of all people should be able to carry this human rights, compassionate care approach. So over to Father Bob, briefly summarizing, he reminded us of this refreshing threefold mission of the Catholic Church: to teach, to serve, and to worship God, and I think we would all share that in the room. And again, he emphasized that PEPFAR had been good for them in some ways, the Catholic community, helping them see both the people and the numbers. And I think you've always been really good at seeing the people. And so probably what PEPFAR contributed was making us all see the numbers. And then the key role of religious leadership is something that you also mentioned, Father Bob, reaching all of those in need. And he really helped us focus on the importance of children. That came up in the question and answer time as well. I'll say a little bit more about that in a few minutes. And I really appreciated some of the things that Matt Kavanaugh talked about, and he was challenging faith leaders, all of us, to, I think, speak louder about changing norms around us. As one of the military officials on the plane I was on coming back from Poland and Ukraine recently as well said to me, "You have got to make noise." And I just thought, but he kept telling me over and over again, and I thought, you really don't know me. I make a lot of noise most times. But, you know, when someone tells you that 5 times on a plane, every day I wake up hearing him say that. But I felt like that's what Matt Kavanaugh was inviting us to do in this norms change, injunction, and invitation. And he also thanked us for all of our leadership in combating stigma and discrimination, and he highlighted some of the wonderful examples from Nigeria and Uganda, so it was really delightful to hear that. So I'm going to say just a little bit about PEPFAR, because I am serving there as the Senior Technical Advisor for Faith and Communities Initiatives. I had that job from about 2017 to 2021, took about a 10-month break, and have just come back the past month and a half. And so I will say that absolutely children are emphasized in the COP guidance. You just look on COP 22 guidance. It's just, online, and what we're getting ready to be working more and more on. Children are definitely very highly emphasized. Adolescent girls and young women, key populations, and healthy adults of all ages. Sandy had intended to say a few things about that, and I think there wasn't quite time for her to say what she wanted to say. But one of the things is really bothering me about HIV/AIDS-related mortality curves, and it shows whispered, like hidden, or I guess obvious within those curves, which I'm seeing in my mind all the time, is hidden stigma and discrimination. Because the highest death rate of all is in 15 to 49-year-old adults. That should not be happening, and it's because we are not finding the healthy living with HIV/AIDS and getting them on treatment. The next highest curve is in those that are 50 to 69. It's basically the same song, second verse. The next highest curve is in children under 5. Come on. And then is what you would expect to be the highest is the next to the lowest, and it's all adults 70 and over. So those, the flip of those HIV/AIDS-related mortality curves show us where we have the gaps that we need to be reaching, and all of us here sitting in the room know the faith-based leaders can help reach those gaps. I know it's getting late. I'll be giving a talk on this afternoon, and some of the models supported in COP 22 that are faith-based models identified in the Faith and Community Initiative, and not only are they effective, they tend to be up to 3 times as effective as the non-faith-based models. And as a scientist and epidemiologist, I'm always looking academically for a comparison group or a control group. I'm here to tell you we have comparison groups for HIV-related work from Kenya, Zambia, Zimbabwe, and Uganda, and Tanzania, and they are impressive. And what we're showing is the value added to the 95, 95, 95. And that is what we need to be selling our faith-based work based on. It's the fact that I think it's because we do successfully combat stigma and discrimination. And when someone feels like you love them and they can trust you, they are going to take the medicine, just like all those people stood up, in Cameroon, whether it was the imam or the priest, to get their COVID vaccines. We are hiding our most precious resource in some sense, and I just beg you to go look at that COP guidance, see the things that are really working, and advocate, make noise for getting support for them. Thank you so much.
Yazapita, Right.
Colleagues,
Good afternoon.
participants, and all other
Good
members who have
afternoon.
joined in this pre-conference on HIV.
So it's my privilege, again, my name is Father Rick Bauer. I'm with the George Washington University Institute for Spirituality and Health after 25 years in Africa. So it's great to be here to kind of help facilitate and moderate this discussion on the theological principles that undergird our thinking, our reflection. It is what we are completely unique on. Sometimes I say, well, we're really good at compassionate care, but I've seen good compassionate care outside of faith groups as well. But theological reflection is uniquely ours. And so we wanted to have a section and to have people just briefly, what are the theological principles that guide us to overcome stigma and discrimination? And then how do we teach this and integrate this into our communities of faith? I'm a bad facilitator in that I didn't get all of your CVs to introduce you, so I'm going to have you introduce yourselves. Maybe come up with 1 or 2 lines and then open up so we can get discussion. We have about 45 minutes for this to look at what's the theology that undergirds our response to stigma and discrimination. Jane, you have the mic. Ladies first.
I think it's fine. I was waiting for you to say you can go now. I'm Jane Nganga. I work and serve at the International Network of Religious Leaders Living with or personally affected by HIV. I'm an ordained clergy and have been working around HIV stigma reduction issues for some time now. Do I continue? Introduce first?
No, why don't you I just want to do like 1 or 2 minutes and some of the theological principles from your tradition or just theological concepts that you use.
One of the theological principles or guiding principles is that of love. And I think for me, that has been central in the work I do and in the service of working with people living with HIV and serving together. I believe that the centrality of the Word of God or even the teachings of Jesus Christ is all around love. Loving your neighbor as you love yourself and ensuring that that which you would not want to be done to you, then I should not do it to someone else. That includes even stigma. And therefore, when you serve and when you engage with people from the lens of love, not looking at many other things, but looking at this person as they are created in the image of God and you love them for who they are, then it becomes very easy for you to be able to support without judging, be able to listen in, be able to see the struggles, the issues that this person could be going through, and you are able to journey with the person and support them as we go by, because stigma is so real at the community level. And of course, stigma emanating from HIV and other situations, GBV, stigma emanating among the adolescents and young people from pregnancies, teenage pregnancies. That can be a whole load of issues on one person. And excluding this person or blaming passing blame is not the way to really provide the supportive environment, but loving and listening. And when you love, you are able to listen more. You are able to look at things from an angle and an eye of support and encouragement, and that provides hope to this person to be able to carry on. So I want to stop there for now.
We haven't heard from John yet today, and introduce yourself, and it's good to see you.
Good afternoon and good evening to those online. My name is John Blevins. I am a professor in the School of Public Health at Emory University in Atlanta in the United States, and I direct the Interfaith Health program there. I have a long history of working in the area of HIV. When I was in seminary, I sought ordination as an out gay man and was not ordained by the tradition that I was raised in. In fact, I was kicked out of it because I was honest about that aspect of who I am. And that was a difficult thing for me, but it was something that today I am grateful for some of the lessons it taught me about how faith communities can be places not only of welcome and hospitality, but also places that show people out the door, and to do so with a kind of righteous piety behind it. And I think that's a tension that remains in place in the kind of work where we find ourselves, have historically for 40 years in the HIV sphere, and continue today. When I finished seminary and I was eventually licensed as an American Baptist minister, my first job was working as a chaplain to people with HIV and AIDS in Chicago in an era of monotherapy in 1992. And the people that I was working with and walking alongside of were in the valley of the shadow. They were facing questions of death, and they were facing questions of death for most of them, with only a very few exceptions, without the comfort of a religious tradition that had accepted them and had loved them. In those days, people were asking those questions about meaning and life and purpose and love without recourse to a religious tradition that offered them comfort. In fact, for most of them, their religious tradition had turned their back on them. And I was a chaplain in hospitals in that setting. And I think those experiences for me gave me an appreciation, a hard-learned appreciation that the work of the Spirit, often in the context of HIV for 40 years and even today, comes most often from places on the margins and places without access to approved institutional power. I read in the Gospels where Jesus says, you hear the wind blow, and you know that the wind is blowing, but you don't know where it has come from, and you don't know where it is going. The Spirit is the same way. And that theological principle for me is really profound around how I think about HIV for two reasons. The first is related to the idea that revelation of God's ongoing God's revelation to us of God's ongoing work in the world comes from places we don't see where it's coming from and don't imagine where it's going, and it comes from unexpected places, that just as soon as we think we figured God out, God comes in a different place and in a different way. And in the context of HIV, that often means that the revelation of love and grace and support in the world isn't testified to by us in positions of authority or power or ecclesial authority. It's a testimony given by people who have felt that they are despised by the world and often despised by families or religious and faith communities. And yet they testify that God loves them. And so that revelation comes from a surprising place. And we can hear it but we don't know where it's going to come from, and we have no idea where it takes us. That's the first aspect of that idea of where the Spirit goes. The other is that I think it's really important for me that if I think that's God's revelation being made real to us in this world today, I have to approach that testimony with a sense of humility and with a sense of confession at my own inability to have heard it in the past. That I have been part of structures and systems, or what the Apostle Paul calls principalities and powers that have kept people's voices and testimonies of God at work from being heard by other people. And that the people who are telling those stories are the best to tell that revelation. That all of our efforts in places like this to talk about the importance of compassion and the importance of hospitality, to speak out and to affirm that we are on the side of acceptance and love and not stigma and discrimination is vitally important, but it doesn't insulate us from the possibility that that kind of rhetoric and that kind of story we tell ourselves can also function in a way for us to kind of feel smug about the work that we do and actually not to be very welcoming in reality in affirming the full humanity of the people that we meet. And out of the tradition I grew up in of the Free Church Protestant tradition, the most important responsibility you have in relationship to your faith is to testify. Testifying is always an autobiography and not a biography. And so in relation to people who are stigmatized in the context of HIV, testifying as to God's work, God being at work in that, is the primary narrative, not of people like me, but of how a sex worker knows that God is walking with her or him, with them. How LGBT community members recognize and know that they are loved by God, even if their pastors tell them that they are sinners bound to hell. That people who use drugs and are working to address all of the dynamics about complicated drug use and also know that they are loved by God, their testimonies are far more important and should be prioritized as autobiographies of God at work in the world, more so than me or a priest or a pastor or a professor or a policymaker standing up and telling how good we do at loving the sex worker, the man who has sex with men, or the person who uses drugs. And if there's one thing that I hope we'll continue to do in this kind of work is to continue to find ways and avenues for their stories to be heard and privileged. Thank you.
Thank you. Thank you. Canon Gideon.
I'm Gideon Biamogisha. I'm a teacher by profession, a pastor by calling, and I'm his student. I think that can save me a lot of trouble, having heard a theological guru speak. So if I say I'm a student, you can excuse the small mistakes I will make. The theological principles. What are theological principles? I understand them as spiritual truth or religious teachings that are supra-time and supra-culture. They were relevant for the past, when they were spoken in scripture times, and they are still relevant now, and they will be relevant tomorrow. They are relevant in Mexico, they are relevant in Uganda, they are relevant in every culture. And one of them, which has already been alluded to by the two speakers, is love. Love in any language, straight from the heart, binds us together, never apart. Once we learn to speak it, everyone can hear. Love in any language, fluently spoken, heals. A friend of ours who was there saying that she's not so sure that we are using language that people understand. The good news is that love is a language that can be understood across. Why? Because the world was created by a God of love. And the world is sustained by love. Where love is deficient, ill health comes in, injustices come in, inequalities come in, stigma and discrimination, which actually, I don't know why up to this time we talk about stigma, but we don't talk about prejudice. Because the root word, the root cause of stigma, most of it is from people being prejudiced about Gideon being left-handed, or Gideon being short or small, or from a certain culture, or, so my father, moderator, one thing I struggle with is that when I opened up in 1992 that I'm HIV positive, my church, my bishop, Bishop Samuel, and Bishop Eliphaz, and all those religious leaders around me really embraced me with love and care and compassion. And Professor John and Tim, who is very conversant with evidence, it is very, very evident that where love is, stigma is not. Discrimination is not there. And because of that, I have achieved zero transmission in my marriage. 32 years, no person can say, Gideon, you give me HIV. My virus has kept within me. Why? Because I've been loved enough to know more about AIDS, to know how it is transmitted, how it can be avoided, how you can protect loved ones from being positive, including newborn babies. Love is the one which forced me to postpone having children for 7 years, even when I could have the children. But to negotiate with my wife, to struggle with condom use day in, day out. I remember a story when I had spent time 2 weeks in Germany and I came burning, to meet my wife. And we looked for condoms. I first looked myself. I couldn't see them. My wife got out of the bed. I think she was getting impatient. Searched with me. We couldn't. And finally, we looked each other in the face and he said, for the sake of love, not transmit my virus to you or yours to me or to our unborn children. Let's pray and sleep. What Father Vitro talks about, sacrificial love, that type of love that can really look into the other and say, for your sake, I'm not going to do this. For 7 years. And when President Bush was visiting Uganda during the start of PEPFAR, after waiting for 7 years, we produced a girl we named Love. And the CNN guy asked me, don't you feel bad that you are producing children, that you are going to leave as orphans? You see that type of... And God gave me good words to say. I said, well, it will depend upon the children. When they hear the story that your daddy and mom waited out of love to postpone having children until it was scientifically possible to have children that are negative, and out of love, we had you through prevention of mother-child. But because of lack of significant love from the community, your dad and mom died before you could know them. Thank God that you have vindicated yourselves. You've loved me still, given me care and giving me support. And here I am, and our last born is now a 17-year-old, and the other one is 20 years old. And so that shows love can be evidenced in these things we are struggling with. My theological struggle is, how come that this love I have tested is not given to everyone else? That is where my challenge really is. You know, that you see religious leaders who are struggling with self-acceptance. They can't freely talk about themselves. Recently, we had a problem in Uganda. A very high religious leader who is positive died, but before he died, he couldn't. The family and himself couldn't talk about it. And as the disease progressed, he developed cancer. And people were so quick to say, "Praise, dear brethren, pray for us. Our family has a person with cancer." Why was it easy to talk about cancer, but not equally easy to talk about HIV? And we lost the person. When I was in Yaoundé, one person from the gay, lesbian, transgender community came to me after I had given my testimony. He said, "I envy you, Gideon, that you can freely talk about yourself and you are still loved and embraced. How come that this love I have experienced, that Jesus talked about, can't spread beyond boundaries of different sexualities, of different races, of different genders, why is it restrictive?" So, in summary, love of law should be guarded by the law of love. I think if the love of law is bigger than the love of law, if the love of law is bigger than the law of love, we get challenges. The love of power, because faith is about power also, religious institutions, that should be matched by the power of love. And finally, Professor Mead, Margaret Mead, the anthropologist, again quotes the theology of the mustard seed, which is in the Gospels, that yes, we may look few in the room, but our actions can grow and multiply and bear much fruit. And so Professor Mead said, never doubt that a small group of people can change the world. If anything, that is all there has been. So I salute you for your mustard seed you have been planting through your efforts. We will end AIDS faster, smarter, and better.
Well, thanks to all who have shared. And I guess my thoughts in terms of theological principles go beyond the individual relationships, which are very, very important, and our individual relationship with God. But I think a lot about two of the very important documents that Pope Francis have written since he's been the Pope. And the first one, the first encyclical letter that he wrote, is called Laudato Si, and the title comes from a song and a poem that St. Francis wrote, just praising God for creation. Laudato Si means praise be to you, O Lord. And a lot of people think that that was written about climate change or environmental issues, but it really is, his theme in that document is integral human development. And he talks about wanting to, encouraging us to look at our relationship with God, our relationship with each other, and our relationship with Mother Earth. And so, yes, environment comes in there, but also our relationships with God and with each other, including ourselves. And I think this is an important theological principle about integral human development, and I think it also is a key for us to deal with issues around stigma and discrimination. And so that's an important principle that I would see. And the second letter that he wrote more recently is called Fratelli Tutti, and this caused a lot of debate in the world, by the media especially, because in the letters of Vatican documents are the first two words in the Latin letter. And so Fratelli Tutti is brothers all, but it's really written about brothers and sisters all, because it's used as a very general form of the word brothers. And here he's talking about there are relationships within communities and with each other. And he talks about a fractured world, which I think all of us are experiencing, no matter what country we're living in. The kinds of fractures, the kinds of nationalism that we see, the kinds of rejection of the other, of migrants, of strangers, and also those with in different key communities, as we call them here. And I think that's another very important issue, and it's based on the love that Gideon is talking about too, that we have to have love for each other. And we don't only love those that we like, but we have to love everyone, because they're all created in the image and likeness of God. And so to me, those are the two key areas that are very basic to, I think, the Christian traditions, but those are principles that are very much in every community, every faith tradition. And also the Fratelli Tutti document of Pope Francis was also very key for later, for him to develop an agreement with the religious authorities of the Muslim faith as well. I think it's important for us to see that on the grand scale, because it's not only the issues of stigma and discrimination against somebody else, or even against a particular community, but it's the fracturedness of our world that we have to struggle with. And finally, John, you had me do some thinking too, and I have to say I respect very much your experience and the experience of many in terms of some of the issues around institutional religion. At the same time, I think that that it's possible to, and here too, I believe Pope Francis has been a great model and example of this, to invite those at the margins and put them at the center. And he particularly insists on our doing that within the Catholic Church, and he himself sits and listens and learns from them. And that's certainly something that's going on right now during his visit in Canada with the First Nation people, and his own apologies for abuses that occurred with the First Nations people, a policy that was developed by the Canadian government, but it's easy to blame the Catholic Church for the abuses only. So I think those are things that it's not only that, we have people at the margins doing it contrary to or against the church, but it could happen within the church as well. Can I say Sure, please.
I agree with you. And I didn't mean to imply that it's only, the only testimonies will be those who speak from the margins and speak out against the church or against the mosque or against the temple, against a religious community. I do think that for those of us who are in the center and have some access, and albeit in different ways, to the center, we also, though, have a responsibility to make sure that we are listening to not only the voices from the margins that are willing to join us in the center, but also those that stay on the outside because they have been hurt, and that part of the testimony will come from those margins, not only, and that the variabilities and the variations by which the Spirit speaks will always be multiple, and they'll always be contextual. And so I'm not disagreeing with you. I think our responsibility to think about that is also to make sure that we're not just detoothing the testimony of those on the margins by inviting them into the center with some kind of sense of they have to come in under our terms. And I'm not saying that you're doing that, but I think that's always a risk.
I know we have, I'm looking for Marc-Henri. Is Professor Mohammed? We do have one more.
My name is Professor Mohammed Karama, representing Islamic Relief from Kenya. I'll give a brief reflection on the Islamic perspective of religion and health. First and foremost, we are aware that close to 85% of the world population ascribe to some form of religion. And the influence of religion can either be negative or positive, but in most cases it's positive. But where the translation and transliteration is handled sometimes, some religions may conflict with medical science. However, we trust that most of the religions have positive identification with the medical science. The Muslim believers have a requirement that their body is only in trust, and they're required to take care of their bodies by making sure that their health is good, and seeking medical care is recommended for all Muslims in that perspective. There's no conflict between Muslims and medical care in the sense that we believe God is the source and the owner of all knowledge and wisdom, and therefore attending to a medical practitioner, we have to trust in God, that God will empower this person to give us the good health. And therefore it is important to have this aspect of faith when seeking medical care. Increasingly, world governments are recognizing the need of the platform in addressing healthcare, and therefore the engagement of the faith groups are increasingly becoming necessary, and therefore there is need for the faith groups to be able to define and clearly align themselves into the health sector to be able also to contribute to the welfare. We need to understand that the communities, the people we work with in the community, they trust the platform better than any other source of information. And therefore, we stand a very good chance to ensure that this, we also contribute. I am aware that, for example, the Christian faith, the Christian missionaries in both Africa, in other developing world, have contributed a lot towards health and towards education. And therefore, we need to maintain this and continue. The Muslims are also coming up in this area now in providing health care. And therefore, it is a source that is reliable and should be able to continue and play a bigger role in future. The engagement of the faith platform is important for several reasons. One is that the communication to the community through the pulpit or through the church or the mosques or the temples are more accepted and trusted by the people. And the second reason also why this forum should be well appreciated is that it is the link between the governments and the people, and it is the easier link, and therefore any communication will be better received when it goes through this platform of the faith group. The primary healthcare concepts recognizes this, and also it is important that the concept of primary healthcare in the developed world, where primary healthcare is that first care that one gets at the lower level, where the community can now get information. This area is also very closely linked to the faith platform, and we need to take care of that. The use of religious scriptures. Many obstacles have been overcome in the healthcare services by the use of scriptures. In Islam, for example, we have many areas that, with regard to HIV, stigmatization, and so on. And even with the changing structures of stigmatization, I want to narrate a recent observation when I was in the northern part of Kenya recently, where an old man was saying that HIV positive people now are more dangerous because they take medicine and they look much healthier than even the other people. But they continue transmitting the infection. This is a form of restructuring of stigma by the people in the community. And therefore, we needed to inform them and be able to overcome this. Religious scriptures are very, very useful in this. We have found the Quran, which is the source of Muslim jurisprudence, and also the hadiths, which are the tales of the Prophet, the words of the Prophet, have become very useful to the Muslims. For example, we have had to use the Quran in able to reduce stigma in the community. In the verse, God says, "O you who believe, do not scoff one another or anybody for any reason." And this has helped us a lot to address the issue of stigmatization. We have also looked at the caring for one another, overcoming stigma. We have seen that God says that those who take care of people in this world, God will take care. The God who is in heaven will take care of them. And therefore, this recommends that we care for one another in the health sector. Previously, a lot of transmission of HIV was through wife inheritance. Islam was very clear in this area, and the verse from the Quran says, "O you who believe, it is not lawful for you to inherit women by compulsion." In other words, it was not legal. The African culture, many cultures in Africa have those trends of inheriting wives and so on. Amongst the Muslim also it was common, especially where the family is rich and one of the brothers or cousins passes away. Instead of that lady going away with the funds, sometimes people tend to force her into marriage. The Quran has been very strict in that. Also, allowing women, poverty was one of other major challenges. And the Quran was also very clear, which says to the women, especially in terms of inheritance, and do not make difficulties for them in order to take back part of what they have gained. And this stopped many people from stopping women and their inheritance. And also the Prophet said, sallallahu alaihi wasallam, and live with them in kindness. In other words, treating women. Many people believe that Muslims maybe are not, they don't care for their women. It is not true. Islam requires that people should take very good care of their spouses and their family members. In as far as seeking treatment and care, especially with HIV, and many people tend to want to be seen going to HIV centers to collect drugs. The Prophet ﷺ says, please seek treatment because God has not created any illness except that he has created medication for it. So we believe using the scriptures will be able to provide us with a way out into this and be able to handle ourselves through the scriptures. In addition to all this, the word of the imam or the pastor or the bishop is much, much more acceptable. And therefore, in a recent occurrence, for example, in Kenya, we saw that the challenges of antimicrobial resistance is now being delegated to the faith groups to be able to address. And this is a major recognition of the faith group in that we need to upscale our engagement with the healthcare in all the way that is possible. I hope that through this pre-conference with the faith groups, we will be able to come up with plans that will enhance our role in supporting the healthcare of this nation, of the world, and all the people for the betterment of the population of the world. Thank you very much.
Thank you. Thank you so much,
dear
Professor
colleagues.
Mohammed. Do you know what our time frame is? I didn't look. We need to wrap up. Okay, then I won't even have my one question. Well, I'll leave it with you for break. My question I was going to ask you and you. How does your personal theology, your image of God, your experience of God influence your mission in HIV and stigma and discrimination? How does your image of God, your theology, your experience of God motivate you to continue that work? We don't, it's just a, you can answer the question outside. We're out of time. I just asked the question, and I will turn this over to Francesca or Ulysses, to Mark, Henri. Well,
Sorry, I'm sorry. I was saying we are going to give the floor to the young man who has a questions, and then we need to move to the workshops, just because there are people online, and for them it's the middle of the night, so we need to respect their time as well.
Thank you very much. Yeah, I'm Ekanemi Turo Ifyong, the chair of the Pact, a global coalition of youths working within the HIV response, working with over 152 youth member organizations across the world. Now, we did a survey towards the HLM, and one of the key things that came out strongly is still the compelling discriminatory laws and policies still affecting young PLHIVs and young key population. And I want to ask, as a faith community, as religious leaders, we understand that we have legislators, we have policymakers who are members of the community itself. And as faith leaders, as religious leaders, you have these what do you call, you guide them, you advise them, usually. You have this influence on them. And I want to ask you as religious leaders, because I've heard a lot of great stuff, but we still have these discriminatory laws and policies still affecting access to HIV services for these young key populations who are at the intersection of the marginalization itself. What are you doing as religious leaders to ensure that those legislators, those policymakers who attend the events, the church activities, are changing behaviors towards ensuring that some of these laws are addressed, and not just bringing their bias into the office that they occupy? And what are you doing also to ensure that your colleagues at the various countries are also doing the same as you speak? This is my question, because we can as well speak about this, but if these laws and policies are still there, I fear we'll be able to achieve the Agenda 95. Thank you very much.
All right, thank you very much. My name is Aaron Sandy. I am a strategic advisor for the PAC. I'm also a board member of Global Fund and also the national coordinator of Association of Positive Youth Living with HIV in Nigeria. I have had instances where a lady is about to get married and an Orthodox church pastor required that an HIV test should be done. And when that HIV test gets done, 2 recent issues I had to interface with. The lady, while courtship was negative, but through to marriage, she became positive. So, and the pastor now insists that marriage cannot continue. And then the pastor go ahead to disclose to the parents of the groom and also to the parents of the lady, inflicting this same lady into some kind of mental health distress because she's not ready to experience the societal stigma. Now, I look at this theme, we are looking at actions to overcome HIV stigma and discrimination and the role of religious leaders. I don't know if we have representative of the Orthodox. I'm speaking in the context of Evangelical Church of West Africa, mission of winning all equal. So this is really becoming a problem. The Anti-Stigma Act in Nigeria prohibits disclosure of anybody's status. It is the client's rights to do that disclosure. But in an instance where the religious leader are now being seen enforcing the person to do a test against their will, the preaching of Christ promote love and faith. Before they agree to marry, they believe they are meant for each other. But now we are seeing how some religious leaders are released. So within this current forum, I will appeal. Maybe we need to start getting in touch with some of these people and then seeing how some of this practice can be readdressed. If not, stigma within the body of Christ or within the Islamic faith will continue to get increasing. Thank you.
Briefly, the last question is that I've been engaging YASEC and team that we have key population, the language of key populations to refer to people who, because of high stigma and discrimination, are not able to access services. But I've been engaging him to also allow us to have key populations, not from the receiving end of stigma and discrimination, but from the sending, those who stigmatize are also key populations, and we need to target our effort, our labors of love there, because many of them don't really do that they think they are doing well. That's why in the international network of religious leaders living with HIV, we introduced the word that was not in English, and we put it in English. It's called misaction. And many people don't, sometimes they stigmatize and discriminate, not knowing. They think they are doing it for your sake. But in the end, their effort produces the negative result. You fly 7 hours from Paris, and you see a signpost saying, "Welcome to Los Angeles," instead when you were coming to Montreal. That's a misaction, but you didn't intend it. So there are these religious leaders who need, I was talking about in the morning, theological accompaniment, and people to engage with, to empower with new knowledge, better skills, more science. People don't know about science that is available, like what I took, that actually people, positive people, even they're discordant, they can produce children without infecting them, they can marry. And the other question about what are we doing for the other religious leaders to do the same. Again, doing what the mustard seed principle. Engage one religious leader, then you become 40, then you become 80, then you become one, and like that. We started in the network of religious leaders when we were one person, I remember. And people were saying, meet the religious leader from Africa, the first to disclose. And I got fed up with the introduction. Yeah? The first, where is the second? Where is the third? And we get together, now we are 13,000 members in 25 countries. adding significant change. We have Kenerera here, we have Tanerera, we have Zanerera, you know, different countries. So the key word here is differentiating between refusing to change from failing to change. The religious leaders accuse young people, oh, they are refusing to change. Are they refusing or failing? How we talk of risky behaviors, but we don't talk about risky environments. So it's high time that we continue engaging. This dialogue we are having is a big step to moving forward. Let's not get tired. We can see the end of AIDS coming because we sang in the morning, where love is, there is no stigma, there is no discrimination, there is no denial or exclusion. What we need to see is what are the barriers remaining to make the labors of love more inclusive?
I want to add my voice to what Canon has said regarding your question. And I think there is a gap in terms of education in understanding human rights issues. And I think we need to see how we close that gap. In Kenya specifically, we do have laws. We have the HIV Prevention and Control Act that prohibits anyone to demand for HIV tests from whoever. But then, because of lack of education around some of these laws, you find religious leaders contravening the law. I remember once I went to a faith community and I asked the bishop, how are you responding to HIV within your congregations? And I was brought for a very huge file. And this file had results, the premarital forms with people's names and photos. And the bishop was very happy to tell me, we always require that they test before marriage. And I took that time to educate them about the HIV Prevention and Control Act. And I told the bishop, you need to repent and we ban all these papers because you will go to jail and serve a jail term. And he was surprised because he didn't know that there was such a law that was in existence. The other way we are responding also in Kenya, we have a HIV tribunal where any issues around stigma and discrimination, you can report to the tribunal because it's not so bulky in terms of accessing the tribunal. It's easily accessible. And therefore, you are able to report and the case is heard and quickly determined. And we are also educating religious leaders around it so that constantly someone is looking inward. What's my attitude? Is this stigmatizing or not? And they are able to act accordingly. Thank you.
I mean, I'll continue, but we have people overseas that are waiting. I think we need to start the sessions.